Your questions about dementia answered. There are an estimated 4,500 people with dementia living in Bristol. There is some misunderstanding and misinformation around the disease. In this video, we speak to a clinician with dementia experience, a community leader, and someone with dementia to address some of the common questions and beliefs about dementia and let you know about the help and support available in Bristol.
My name is Nikki Hobbs and I am the Clinical Services Manager for the Dementia Wellbeing Service. My role is around the operational delivery of the service day to day, and my background is in mental health nursing.
I'm Fleming Carswell. I was a consultant physician for approximately 40 years, latterly in the Bristol Children's Hospital. I had a diagnosis of dementia without specific type 2 years ago.
My name's Amira Cole. I'm a member of the African Caribbean community here in Bristol. I've delivered many community activities over 30 years. I've worked at the Kumba Project for Full Circle, and I'm currently volunteering at the Malcolm X Community Centre as the director.
What is dementia? What does it mean?
Dementia is an English medical term. It describes a collection of symptoms including memory loss, confusion and behavioural changes. Those are the three things to think about when you think about dementia. Much like a heart disease or liver disease, dementia is a disease of the brain. So much like your heart or liver can begin to fail, as can your brain.
Sometimes people say dementia is a madness and there is some stigma around it.
I agree. People do associate it with mental illness and there is some stigma around it. But let's be clear, it's a physical illness, not a mental illness. Even if it were a mental illness, there's no need for there to be any stigma around it. It just makes it harder for those with the condition and those supporting them. Many years ago, there was a stigma around cancer and people didn't talk about it. And it's much the same with dementia. Like we talk about cancer now, and there is no stigma associated with it. We need to get to that point with dementia.
Some people say that memory loss, confusion and mood changes are just part of getting old. Is that true?
Some of us do become more forgetful as we get older or at times of stress or illness, but dementia is a different type of forgetfulness. Your memory will be more noticeable. You may see an impact on your ability to carry out day-to-day activities. There may be some changes in mood and an increase in confusion. It's important that you speak to your GP about any unusual symptoms that you notice because they can be investigated and treated with appropriate medication.
How does dementia affect people?
Dementia can cause memory difficulties. It can have an impact on people's ability to recall conversations or things that happened recently and cause them to repeat themselves. It may also have an impact on their ability to plan, organise and execute tasks. Dementia can affect how people feel and behave. They can become sad, angry and confused. A person with dementia can find it hard to carry out daily activities. This may be cooking, shopping, using their bank card or getting dressed.
How can you tell if a person has dementia?
If someone's worried about their memory, they should see their GP. The GP will ask the person some questions and may send them for a blood test. The GP may ask the person to go to hospital or the memory clinic for more tests. They may be asked to go for a scan. This helps the doctors to see how the brain's working.
Is there a cure for dementia?
Dementia can't be cured, it gradually gets worse over time. Although there are some medicines that can help with the effects of dementia and the doctor can explain these. There are organisations that can support people with dementia in Bristol, such as the Dementia Wellbeing Service. We work to ensure that people with dementia and their families have information and support.
A lot of people have been asking, can dementia be prevented?
Dementia can't be completely prevented, but there are things that people can do that can make it less likely for them to get dementia. Staying active and lots of exercise can help prevent dementia, as can a healthy diet. Equally, things like not smoking and not drinking too much alcohol can help prevent dementia as well. Being social and seeing family and friends regularly may help prevent dementia, as can doing new things like puzzles and quizzes which stimulate brain activity.
Can a person with dementia still enjoy life?
Yes, a person with dementia can still enjoy life, especially if they have support of family and friends. They may just need to change the way they do things. People with dementia may feel lonely, angry or confused. Keeping as active as possible, socially, mentally and physically, can really help. It can boost memory, self-esteem and help avoid depression. Living with dementia is challenging and they may need help and support, but having dementia doesn't change who you are.
How can we support people living with dementia?
Small things can help. Using a photo can help the person remember people and events. Notes and labels can help the person find where things are. A calendar or diary can help the person to remember dates. And you can help the person with dementia to stay in touch with family or friends. You can support the person to do some physical activities like walking, dancing or gardening. And lastly, you can help the person with dementia to do things that they enjoy or take up a new challenge.
How important is it to get help with dementia?
It's very important to get help. It can be difficult for people with dementia to understand what's happening to them, and it can be difficult for people supporting them as well. Your GP can refer you to the Dementia Wellbeing Service. This organisation is a partnership between Alzheimer's Society and Devon Partnership NHS Trust. The Dementia Wellbeing Service supports people with dementia and their carers. It's a free service and we can access interpreters where required. If you are worried about your memory or somebody else's memory, then there are a lot of professionals in Bristol who are here to help you.
If you think that you or someone you know may have dementia, then speak to your GP who can help. This can lead to early diagnosis and enable support both for you and your family. Your GP can also refer you to the Dementia Wellbeing Service. If you are referred to the Dementia Wellbeing Service, you will be connected with a dementia navigator and a dementia practitioner. Dementia practitioners are qualified members of the care team who work closely with the person with dementia and their GP to identify and support people with memory problems and possible dementia. Dementia navigators are there to support the person who has a diagnosis of dementia and their carer. They work in a person-centred way, trying to maintain the independence of the person with dementia and promote their quality of life. The navigator will look at local groups and activities in the community as a way of enhancing their quality of life, as well as signposting to other agencies, providing information, guidance, practical and emotional support. If you would like to speak to someone about the referral process, or you have a question about the Dementia Wellbeing Service and how we may be able to help you, you can ring our access line on 0117 904 5151. Lines are open Monday to Friday, 8 AM to 8 PM. Bristol Dementia Wellbeing Service also have a website, www.bristoldementiawellbeing.org. The text on the website can be translated into many different languages.